I love this background on it, and the definitions and some of the traditional treatments and causes. So
Mhm.
now let's talk about what kind of sets you apart. Some of the non-traditional treatments. So what is that about? Is it about prevention? Is it about treatment? Go ahead.
Sure. So if you start with somebody who's coming to you for atrial fibrillation, so their chief complaint is AFib, and it may be in that paroxysmal pattern, meaning it comes and goes on its own. It shows up and then it disappears, and it's kind of playing hide and seek with you all the time. Or you come in a persistent pattern, meaning the AFib is always present, or it's present for weeks at a time, without interruption. Those two distinctions are important, but they're presenting to you with this. Then we look and we say, what are the contributing factors that are in front of us in your life that we can potentially reverse, hoping to reverse the substrate of atrial fibrillation, hopefully creating the milieu in the heart that makes the atrial fibrillation disappear or creates a situation where we can regain control of the heart rhythm. So there's very nice graphs of all the contributing factors that all point into AFib and make that rhythm change possible. Traditional heart risk factors are all part of it. So high blood pressure, for example, if your blood pressure is high, that's going to result in increased pressures inside the atrial chamber. So now the atria is stretched. And when it's stretched, it's electrically irritable. So high blood pressure is probably the number one risk factor for atrial fibrillation. We know that glucose is highly inflammatory in our entire cardiovascular systems. Probably the number one reason why we age and eventually die in the first place is high levels of glucose in the blood. That inflammation is going to impact in the atrial chambers, make them electrically irritable, create fibrosis, cellular dissociation over time. So diabetes, people who have the most glucose dysregulation are going to develop more atrial fibrillation. So we see risk factors like that.